The laparoscopic pectopexy is a new technique of prolapse surgery especially for obese patients. The round ligament of uterus is used as anatomic landmark for identifying iliopectineal ligament. We start with a superficial incision of the peritoneum next to the round ligament. A strict superficial preparation reduces the danger of an accidental injury of nerves or vessels. Iliac external vessels and the obturator nerve are identified. The soft tissue of the pelvic wall is bluntly prepared until the iliopectineal ligament can be shown. Here you can see about 4 cm of the lateral part of the iliopectineal ligament. The same procedure is repeated on the left side. As you see, the insertion area at the lateral pectineal line of the pubic bone can be well visualized via a direct transperitoneal access. This method is easier and more secure in patients with difficult surgical field. The mesh is fixed with 2 stitches to the left side iliopectineal ligament. We use an intracorporal knot tying technique. In this region, the ligament gives a strong basis for the fixation. The iliopectineal ligament has been used successfully for colposuspension and is statistically significantly stronger than the sacrospinous and arcus tendineus of pelvic fascia. The fixation is now done on the right side the same way. If the preparation is done well, there is always enough space to the vessels. The surgeon should be experienced in the anatomical characteristics of the female pelvis and an intracorporal laparoscopic suture and knotting technique. We favor a fixation on the cervical stump and combine the pectopexy in general with a laparoscopic supracervical hysterectomy. Here, the cervical stump is elevated to the intended tension-free position and fixed with 3 stitches to the middle of the mesh. If the mesh is too long, it should be shortened before fixation at the right side ligament. If the mesh is too short for a continuous fixation, a second mesh starting from the right side and ending at the cervical stump should be preferred rather than a non-tension-free fixation. The here used mesh measures 15 to 3 centimeters. The laparoscopic pectopexy provides a stable and tension-free replacement of descended vaginal or uterine parts, a good alternative to sacropexy in case of a limited access to the anterior and longitudinal ligament due to a difficult surgical field, and a high acceptance of patients due to the reduced morbidity. At last, the peritoneum is sutured continuously using a 2-0 resorbable suture of 35 cm length with attached needle. The urinary drainage is removed at the end of the operation. There is no need to insert intracorporal drainage. Postoperatively, our patients start with mild form of pelvic floor exercises. Non-steroidal antiphlogistics will be sufficient to reduce postoperative pain. It is not required to purge the bowels or to continue antibiotics. Due to the Pectopexy, we are able to offer nearly every woman a laparoscopic procedure for prolapse surgery.